and certainly one I would definitely agree with, I'm getting my words mixed up. Thank you so much, everybody. I'll just, round of applause again, please. Thank you. I will now present or bring in David Jephson to talk about developing health trends in England in Quarto. Nicely fits that R Python thing, because you can use both.
Yes, indeed. Morning, everyone. I'm Dave. I'm also from the Department of Health and Social Care. I'm actually from exactly the same team as the guys who just presented, but I thought I'd kick us off by introducing our team. So we're going to give you a bit of background of where we fit into DHSC, the background of this project itself. Going to give you a little view of the final product and some of the technical aspects, and specifically how they kind of do things that improve, we think, the user experience on the product. So firstly, the PHA, Population Health Analysis team. We're one of the health improvement functions that were moved into DHSC when Public Health England was disbanded a couple of years ago. We have a range of topic areas that we particularly work on, but kind of most relevant to this project, we have the kind of lead for non-communicable disease surveillance. We feed into a lot of the fingertips profiles. So fingertips, hopefully most in the room are aware of fingertips. It's a wide-ranging data collection of population health information publicly available to anyone to go on the website to use. And we also have a number of areas of our work that we class as cross-cutting, so across the broad range of what we class as public health rather than being topic-specific. We sit in the Chief Analyst's Directorate, which is a good place for our team, really. We report upwards to the Chief Scientific Advisor directly, and we have indirect reporting to the Chief Medical Officer and his deputies. So with all that in mind, it wasn't really a surprise when we had a request from one of the DCMOs land with our team. It was quite a broad request in the initial stages. So she was looking for a way of reporting on a routine basis non-communicable disease surveillance, so that we can pick out things that may be heading in the right or wrong direction, probably more likely the wrong direction for things that they want to action. So it was quite a broad spec at the start, so kind of from the K2A session, I don't know if anyone was in that session, the previous slot, we kind of did the planning part of that by sitting down with the DCMO and her team to work out what we actually want, what the requirements are for this product. So essentially it's something where we could easily get across a key message, so something's going in the wrong direction, for example. So that we said probably the audience will be still public health professionals, but give them something that gets a simple, clear message across for the general public to understand what's going on. And then the general public in that kind of terms, they defined as an 18-year-old with a good GCSE in science. So that kind of level is what we're aiming to kind of provide for. I'll jump past frequency, go to data, because I mentioned fingertips on the previous slide. So we have lots of data in fingertips. The kind of steer was, let's not create any more. We've covered lots of things in the fingertips outputs. We don't want to throw more data at the public or the public health professionals, because one of the things we know about fingertips is it can be quite overwhelming, the quantity of data that's in there already. So let's not do any more. And so let's utilise what's in fingertips. Fingertips is updated every month. Various indicators get updated each time. So that kind of puts us into saying, let's update this, whatever we're going to do on a monthly basis. The initial ask was for national, because that was kind of the level that the DCMO was wanting to kind of look at. But we knew there was also requirements from our regional colleagues to kind of look at doing something similar. So if we can do something once for national, let's see if we can do it at a more regional footprint. And obviously, we want to be looking as a measure of change at trend analyses to see what's going, improving, what's worsening. So we kind of had that initial meeting, went away, thought through some ideas, what ways we could kind of present this to the audience that we needed to present. couple of us were fortunate enough to work on the UK COVID dashboard while that was kind of being developed and routinely updated. So we knew that this was well received by that kind of general public audience. It got the messaging across in a clear and concise way. We also knew that that had been kind of progressed by other teams over time. This is one that ONS did on climate change, so they kind of had a similar way of having a front page with a few kind of key trend lines, but then they'd also developed it to show a bit more detail on kind of drilling in and a few chart views there that we kind of saw and thought, yes, this could work for what we need to do. So we refined everything from there, went back and said, look, this is what we think we can do, what we want to do. So yeah, I say public-facing dashboard kind of approach, building on the COVID dashboard style and in the kind of gov.uk style, which was widely kind of recognised. We said before, we're not going to create any new indicators. We're going to use existing data and utilise the API that is behind Fingertips. So we didn't want to set up something that had its own database behind what we were going to provide to the public. We set out to kind of do an alpha version with 12 topics on the summary page with 5 or 6 indicators on the details pages. Probably learning point number one we had at that stage was that we produced something that had lots of placeholders for the topics and the indicators, and then when presenting it to people, the conversation almost immediately went to, oh, but can it show this? Can it have this in it? So having a more sensible set of placeholders might have been a way of getting more useful feedback on the product itself rather than on the content. We also wanted to make sure we linked to Fingertips to aid the user journey. One of the kind of steers we've had from the CMO is that Fingertips is quite complicated for a general public audience, and that's kind of where we're aiming for this to be. So we wanted to find this potentially being a way in to Fingertips for a more general user. And yeah, that's the bottom point that I've covered there. So we had the initial request in early 2023. An initial prototype was developed pretty quickly, and that's what we were showing to people, as I mentioned before. We did it for England and for the regions. Gained a lot of feedback on the indicator content, as I mentioned, so that led to us then putting that all together into an alpha version that was summer 2023. The external version probably wasn't viable until we had a lot of the indicator content updated with the revised population back series that ONS published towards the end of 2023. So that had a very kind of rapid turnaround of producing a lot of the indicators for the 2012 to 2020 period, making those available in Fingertips, which then we could pull through into what we'd done. And something which in a government department you always underestimate the amount of time, ministerial sign-off led us to take a little while to get it finally over the line, which happened in May 2024, and we've been updating it monthly since. So I had the idea of a live demo when I pulled these slides together and quickly abandoned that, so here's some screenshots. So here's the initial product and what it looks like currently. So it's got that gov.uk look and feel. It's got those simple, clear trend lines that are shown. I think it's something that we hope is easy to use. So there's a couple of navigation options that people have from this home page. You've got a couple of drop downs on the area name itself. You can change the region through that. You've got the regions in the top right where you can click through to say pick my region to show the summary page for. And on changing that, everything looks exactly the same. The lines just change to show the data for the particular region. Should probably jump back one step. The URL for this is quite complicated. Best way of getting to it is through the Fingertips homepage. There's a banner at the top. Click on that and you get through to health trends. The summary chart cards, we kind of call them for each of the topics. We realised from the kind of COVID dashboard experience that people click on things that you don't expect them to click on. So basically every aspect of that card is clickable. You click on the title, it gets you through to more details on that topic. You click on the numbers, that takes you through. You click on the line itself, everything goes through because we know that's what people do. So clicking through, you get more details on each of those particular topics. You get that same chart, the kind of headline chart for each of the topics at the top of each of these details pages, as we call them. Each of those then has kind of the visualization with 4 tabs at the top: chart, table, download and more information, so the chart appears as default. I'll come on to the others in due course. Below the chart we get a bit of a commentary line, and what we've kind of done with this is basically nothing is written on a monthly update. It's all generated through the API information that comes through from Fingertips, so the overhead for kind of updating this is much reduced. And then I think the last screenshot I've got, similar, is one where we'll show here's what occurs when you change it to a region. You obviously get England as the comparator, and then the region as the other line on the chart. Moving on to how we did this, so Quarto was mentioned in the title, and Quarto indeed was what we used. So for those of you who are not familiar with Quarto, it's very similar to R Markdown, but probably more powerful. You can write the code either in R or Python. We went down the R route, but it allows more things to be done. So you can do HTML like we've done for our outputs, but you can do PDFs, you can do slide sets, all sorts of things like that. And you can do more kind of technical things, so it gives you the ability to include JavaScript in your outputs, so that's what we used for the kind of regional drop-downs and things like that. And it's indeed more easy to create style templates, so the gov.uk style template that we kind of use for this is something that's been kind of generated as a template that others can go away and use. And that was kind of ideal timing in terms of when we were pulling this together. One of our other teams was working on the kind of templates project, so it kind of could have a two-way feedback mechanism. They were producing a template, we could say, can it include this, and kind of vice versa. And those templates now for HTML in the gov.uk style, DHSC style and OHID style are published on the DHSC Data Science GitHub pages, and I think there's also some PowerPoint versions as well. So they're easy to pull through and reuse, so that's one of the real helpful aspects of using Quarto. So the structure of the project, when we set about to do this, we kind of wanted to do it in kind of a modular way, so we knew that we had 9 regions plus England, we had 12 topics, we had indicators within those topics. We didn't want to basically have to recreate each page individually, so we kind of modularized it, worked out what the data, the charts and text we needed to pull through from the Fingertips API would be, create the relevant functions, pull in the relevant images and styling, and develop any of those as needed using the government analysis function guidance. And within each of those, we could then create a Quarto to create each of the content chunks. So, for example, one of those cards you see on the summary page, that's one particular chunk of code that would pull in all the relevant information and create that. And then we have the page structure codes, which then would create the pages using those individual bits, pulling them all together to create those. And by doing parameterized and conditional rendering when producing these, we could get it to automatically pick out the right indicators for those topics, the right number of indicators that appear on each page, and so any changes to the content that we feed in wouldn't impact on how the pages themselves are produced, and any changes we want to make to the display or styling would be one change rather than one change per page or per chart, so that kind of gives us a better way of kind of maintaining this in the future. So here's a few examples of what we've used. So just giving the idea that this modularized approach means we can pick and choose the best way of creating each of the individual items. So for the summary charts on the front page, we use ggplot2 package, but for the ones on the detail page, we use plotly. I've put some bits of code on the slides, but one probably more interesting bit on this particular one is the very bottom part there, which is around the, for those who've seen Plotly charts, there's the little icons that can appear at the top corner. They're not actually accessible for screen readers and things like that, so in order to meet our kind of accessibility requirements, we've actually coded in the removal of those aspects. So those have been taken out of the final product. We knew from COVID dashboard experience that lots of people use these sort of things, not necessarily on desktop, but on a tablet or mobile device. So we've added in to the CSS the relevant code that basically goes from the 3x4 grid that's on the kind of desktop page. So if you're on a narrower screen, it can go down to a 2x6 or even the 1x12 on a mobile view. So I think that's important for kind of thinking about these sort of products, that you know the devices that people are likely to be viewing them on. So that's how it looks on a mobile view on the right-hand side there. I mentioned accessibility, and there's a few other things that we've kind of picked up along the way. So I mentioned the 4 tabs at the top. The table tab is the second one along, and that helps us meet the accessibility requirements for non-text content. So where you've got the chart line on the first tab, the second tab gives you all the information that sits behind that chart, which will allow the kind of screen reader views to pick up that data and give the information to the user in a way that they'll be able to kind of to get they'll provide them equivalent to the chart. We also provide the opportunity for a data download. That's in a CSV format, so I think that kind of gets the data to people who want to see it in any kind of onward way of viewing the data. And I mentioned the ability to click on all the different aspects of the charts on the summary page. That in itself can create issues for how things come out on keyboard users as they're tabbing through. So this by changing parts of the code there, we could make that a better experience for those users, rather than have all of the different links. Every bit being a link makes it kind of quite unwieldy when you're doing that. So along the way, we've kind of always considered the accessibility aspects and kind of done an accessibility review on the end product itself as well. And then when we kind of tend to wrap these things up, you kind of have a slide saying where we're going next, but I'm going to be slightly different, have one previous to that saying what we're not going to do next. So we've kind of published this and had lots of feedback saying, yes, this is great, clear, concise view of what the situation is in the areas that we can see the data for. Obviously, it's probably quite expected that lots of people say, can we have this for our local area, our local authority, ICB, etc. Can we have it showing more inequalities information? I think we've probably 2 aspects to how we considered those requests. We wanted to make sure we didn't lose the simplicity of navigation of the product that we've created. We want the audience to remain engaged and kind of getting to the information they want easily, and not really wanting to have it recreate fingertips. We know that for local areas there's still a huge amount of data that's out there in the fingertips platform itself, and we didn't want to kind of suddenly end up recreating a whole new version of fingertips in this way. So what we've got in the more information tab, we've put basically the ability for the user to be linking through to the fingertips platform, but in a way that's a curated link. So basically it drops them into fingertips while looking at exactly the same chart that they've been looking at in health trends. So they've got that familiarity with what they're seeing, and then they're not kind of just dumped into the fingertips homepage with all of the different options that they get. They're in a more familiar space where they can then potentially click through to change the geography, change the data type view. They're within a profile that gives them more information on that particular topic. So they kind of a more comfortable landing, I guess, into fingertips is what we're kind of aiming to give people in that. So that's kind of how we developed that more information tab there. So yeah, what is next? We want to do more user work, so we're making sure that the users are getting what they want from it. So mention accessibility, so more on that to make sure that we are meeting all the accessibility criteria that we can do. We've added Google Analytics now to the site, so we hopefully get some more information about who's using it, how they're using it, that kind of thing. But we've also got within kind of the fingertips team in DHSC that we're working closely with some user specialists. So they are kind of on board with helping to kind of establish the user journeys and work out how people are actually behaving when they get into the sites. And as part of that, feeding this into a wider piece of work, which is the the next kind of generation of fingertips that's ongoing, that is going to hopefully make the overall fingertips user experience better anyway, and this can then potentially become part of the core fingertips output. In the meantime, the fingertips homepage, I say, is the best way to get to it at the moment. It's not entirely jumping out of that homepage at the moment, so there's an ongoing bit of work around the fingertips homepage redesign, which hopefully will make health trends more prominent. And then there's obviously the kind of just checking that the indicators that we've got included are the right ones, and kind of on a follow-up meeting we had with the Deputy CMO, she suggested a particular indicator around economic inactivity due to ill health. So that's one that we'll be developing with our wider determinants team within population health analysis to develop the indicator and then onwardly present it through fingertips and into health trends. And I think I've left probably what's going to be the most exciting part for most of the analysts in the room. We're hoping to package all this up, make the code available through GitHub, and that would then give the opportunity to hopefully go in some way to meeting those local requests, where we'd have the package where you could plug in the areas that you're interested in, the topics and the indicators within those topics that you're interested in, and have it generate HTML pages that would look and feel like this, but with that changing content. And then if you're interested, you could then look into changing the branding with your own templates or within your own changes to the styling to make it a more locally branded kind of product. So that's where we hope to go next with all of this. I think, yeah, that's me onto my questions slide. I think all the links here are kind of to various different bits of it. I think these are going to get circulated at the end, aren't they? I hope.
We can certainly get it. NHSR community would be the best place to find those. We can certainly get that to you. But round of applause, thank you. The recordings for HACA will be on the HACA site, and NHSR community, just to add, will be linking to HACA as well, so that we can find each other one way or another, I'm sure. Just to remind people, Slido questions at slido.com 3716942, where you can add your question and also uptick your favourite one. So there's been movement as we've gone along. And I think you've answered a question already about open source, but I will still ask that when it comes to it. That's the first one. Are there any intentions on making the code for this dashboard open source? I know you've answered that, but I just want to add from the comment, I think it will benefit a lot who regularly report on fingertips indicators. But also, when you say packaging, I'm going to add to the question about accessibility, because I think that was another feature of it. Mm-hmm. I suppose it's when do you think it would be available, and will it kind of cater for all of those needs?
That's a good follow-up to that question. Yeah. So I think it's one. Yeah, I think I put on the slide. We hope to do it soon, but obviously priorities may conflict. But we've got it definitely on the list of things that we know would. And this maybe is evidence that it'd be more useful. Again, we can push it up the list possibly. I'm looking at Sam, who's obviously who's one of the team has been working quite a lot on this. So yeah, I think we'll make sure that message goes back to say let's try and prioritise that. I think probably some of the accessibility aspects are more within the template side of things, probably. So I think obviously you would get as part of the package the already published ability to use the templates that we've created. So I think probably as people would maybe use the templates as a starting point and then go on and develop from there, I think it's always the case that people should bear in mind the accessibility aspects of anything they're doing. So there's a risk that people might go and use the templates and start making things break the accessibility kind of guidelines that we work to. So I don't think there's a lot we can probably do to stop people doing that, but I think we probably just would, hopefully remind people of those sort of things that they should do when publishing anything internally or externally. And it's not just the fact that it's external that makes accessibility important. Anything that's internal as well should still have the accessibility criteria applied.
Wonderful. It sounds like there's some really strong learnings from the COVID dashboard that were applied to the development here. Are those learnings documented anywhere for others to use as well?
Oh, good question. That is, yeah. Possibly in places. I think there was around the time when we were actually working on the dashboard, there was a couple of blogs and things like that published, but I don't think there's been any kind of formal evaluation or anything like that that's kind of been done. So it's kind of, I think at the time obviously things were moving very rapidly and you're kind of learning as you go and maybe not documenting, so perhaps there isn't quite as much there that might be, but yeah, I think there's, as I say, a couple of blogs around the kind of how it was developed and why decisions were made to do things in the way that they were done on display and things like that. Yeah.
What kind of user research did you do, or during, I suppose, or post-launch evaluation? Are you doing that now?
Yeah, so that's like kind of mentioned the next steps is kind of try and get a bit more of the user side of things. I think initially it was more from, it was one of the cases where the person who's requesting the thing, because it wasn't necessarily a dashboard kind of view at that stage, isn't necessarily the person who's going to be onwardly using it all the time. So I think it's one of those where we kind of got the steer from them and then kind of tried to get a broad range of views, but probably not necessarily pinpointing the actual users at that stage. I think it was tricky to identify those early on. So I think it's one of those kind of where you get the best you can do at that stage and then learn and iterate as you go from doing it by publishing the version and getting feedback is the way we do that.
Bit of a change in sort of like the aspect of this. Is the region the lowest? What is the region lowest that you can go to?
So,
and can you get to the county or PCN, which is primary care network levels?
So on the health trends visualizations, the regions are the statistical regions, the ones that ONS use kind of broadly across all topics to kind of have a consistent view. I think the former government office regions, as they're also known. So that's what's presented on there, and that's using that level of geography from fingertips. As I say, the user can link through into fingertips. I don't think all of the indicators that we use are available at smaller levels than regions, but most, I would say, are. So by that kind of navigated way into fingertips, users can then change the geographies that are there. Certainly counties and unitaries is kind of one of the core geographies of fingertips. Increasingly ICBs are being added, so those sort of geographies they can get to from the fingertips data if it's available at that granularity. PCNs, I think less so, to be honest. I think we don't kind of generally drill down that far, but we do have a number of other geographies, and so it's worth kind of if you find an indicator you're interested in particular from health trends, drilling into fingertips through those more information links and then changing the geography. It'll generally tell you what is available, what isn't available, that kind of thing.
Back to technical. Have you considered the GDPR implications related to Google Analytics, for example, allowing users to opt out?
I think that's, yeah, so we're basically piggybacking on the Google Analytics that are already in place from fingertips, so that has kind of done all that consideration as part of when that was added to fingertips, yeah.
What was the trickiest aspect to code? What took the longest to figure out?
Oh, that's a good question. I think in general, we worked in kind of an agile sprint-based way, so things tended to feel like they were moving pretty quickly. Although probably if we look back on some of the tickets, it may have been that they were around for several or more sprints and didn't kind of get over the line so quickly. But I think with the way we chunked it up, it kind of felt like it was always kind of moving, and the way we iterated was pretty rapid. I mean, on a non-technical side, the things I mentioned that took the longest were kind of the getting sign-off for actually publishing the final outputs, and the wait for the data. They were the two non-technical things. I'll look over to Sam. Is there anything you want to comment on the technical side? Sorry? JavaScript. Oh yes, yes. Yeah, I think that was Java. For Mike, JavaScript was one aspect that I mentioned that we included, but the team were learning as they go on that kind of side of things. So inevitably, it takes longer to implement when you're using a new thing for the first time.
Mm. Does the metadata sit within the Health Trends for England dashboard, or is the user directed to the metadata on fingertips for consistency?
It's the latter. So yeah, I mentioned the more information tab. That has the links to the data, but it also has the equivalent link to the exact metadata for the indicator that we've pulled through. So yeah, we're not duplicating. We decided we didn't want to kind of again pull through all the information that we've already got in fingertips. So that's still there in fingertips and linked through from the more information.
Thank you for all these, but we've got one more.
One more.
One more. Why did you end up using Plotly for the detailed graph rather than ggplot2? That's packages in R for people, just to clarify.
That's, I don't know if there's anything specific. I think it's probably more the interactability. Yeah, so I think the ggplots kind of gives you, the Plotly gives you the options to kind of the hover overs and things like that. Obviously, as I mentioned, we took some of those options out from the accessibility side of things. But I think in general, it's a better experience for someone who's kind of trying to interact